So you made it through the first week. Now we're on to the second week of recovery. Things start to get a lot easier, and at this point you're typically looking pretty good. There are two main things in terms of wound care that I want you to keep doing during that second week of recovery. The first is the antibiotic ointment. The incision on the bottom of the nose is typically healed by this point. At least the top layer of skin is nicely healed over. It's still important not to put tension on that incision, but in terms of topical wound care, the only thing that you need at this point is usually sunscreen, and that area of the nose doesn't get much sun exposure. But the inside of the nose, sometimes incisions are still healing a bit. And so I like to have you continue to use the antibiotic ointment 3 times a day just to the inside of the nose. So you just use the cotton tip applicator, put a little bit on, and then just gently coat the inside of the nose like that. And then you can clean your nostril, and so there's not really any, you can go out in public and nobody will notice you have that antibiotic ointment in there. The second thing that I encourage individuals to keep doing during that second week, and ideally up to the third and fourth week if they don't mind, is taping the nose. And so when we do rhinoplasty, we lift the skin and soft tissue up off the cartilages and bones of the nose. And so in order for us to see the shape of the underlying bone and cartilages, we need that skin and soft tissue to heal back down. And so compressing that skin down onto the structure of the nose can really help decrease the swelling and expedite the results. And so this is brown paper tape. It comes in a roll like this, and this is how you tape your nose. The first one goes up on the bridge. Next one right below it. Third one below that. And mine might be a little bit narrow. You want the tape to kind of go out to about here to get that full compression. You cut one piece of brown tape like this with a little V in it to help give some compression to the tip. Here's a few more longer pieces. So if you're hanging out around the house, I encourage you to leave this tape on. If you're going out and don't feel comfortable walking around like this, just put it on at night when you get home and leave it on until the next day. When you're going out, you just gently kind of peel the tape off. It is pretty sticky, so sometimes it's hard to get off. You can use an adhesive remover to help peel it off. And you can just peel it off before you go out. Some people, their skin does react a little bit more to this tape. And so after the first week, during the second week of recovery, you can gently wash your face with a gentle facial cleanser.